Hello, my name is Amy Ashcraft, and I'm an evaluator in the Department of Health and Human Services Office of Inspector General, also called the OIG. Our mission is to protect the integrity of HHS programs and the health and welfare of the beneficiaries served by these programs. In this video, I will share insights from recent OIG studies on quality of care and patient safety in Indian Health Service hospitals, or IHS hospitals, and offer insight that may be useful to you as you consider your work maintaining and improving the health of American Indian and Alaska Native, or aian people. First, let's cover a few basics about our work related to the Indian Health Service. Then we will review 5 key challenges to its operations, which have been a significant focus of the Indian Health Service's recent efforts. IHS is responsible for providing health care and related services to the 574 federally recognized tribes. To fulfill this mission, IHS directly operates 24 acute care hospitals. IHS requires these hospitals to be accredited by a nationally recognized accrediting organization and to comply with Medicare's conditions of participation for hospitals. IHS offices and facilities are full of dedicated and skilled providers who care deeply about their work, yet reports of inadequate health care services for American Indians and Alaska Natives have concerned the federal government, community advocates, and tribes for many years, and appear to be the result of underlying and persistent challenges. We in OIG are committed to continuing our work to assist IHS in strengthening patient care in its hospitals. We believe that IHS as an organization can make improvements that will allow their people and systems to operate effectively. Through our studies and evaluations, we identify specific opportunities for improvement. IHS uses these findings and recommendations from our studies as a jumping-off point to make changes and to enhance both the quality and patient experience. You can find additional information about IHS's specific efforts directed at quality of care in the companion video, IHS Strategic Plan and Quality Priorities. In this video, I reference 4 reports by OIG, each of which is linked below. These studies shed light on opportunities to strengthen the quality of care provided by IHS. The studies are IHS hospitals, long-standing challenges warrant focused attention, IHS hospitals, more monitoring needed to ensure quality of care, organizational challenges to improving quality of care in IHS hospitals, and case study, IHS management of Rosebud Emergency Department closure and reopening. Now I'd like to highlight 5 overarching challenges we identified during these studies. They relate to organizational structures, performance improvement, the provision of services, including maintaining clinical competence and the scope of available services, and finally recruiting and retaining staff. So one challenge identified was a lack of formal structures, roles, and policies. IHS officials in headquarters and area offices and in facilities were sometimes unsure of their roles and responsibilities and how those responsibilities were divided among officials and offices. This uncertainty could result in inefficiencies, coordination gaps, and lapses in which those responsible for a task might not fully embrace or complete it. To address this challenge, we recommend that IHS headquarters, area offices, and facilities further develop their internal structures, ensuring clear roles, responsibilities, and accountability. We encouraged IHS to align its policies and practices with the agency's needs and objectives. This includes analyzing whether policies and roles are practical and useful in day-to-day work, that they were not aspirational findings that no one could reasonably follow. We also encouraged IHS to ensure that all officials and staff have a clear understanding of policies and roles and that the leadership expected adherence to the policies from everyone. This benefits staff in all types of roles because it promotes clear direction for performing tasks and a more equitable system of accountability. As with any system, if everyone knows what tasks are expected for their roles and others, they could collaborate and work together more effectively and efficiently. We also recommended that IHS undertake an urgent effort to address long-standing barriers to provide the highest possible quality of care. This recommendation included developing a new agency-wide strategic plan with actionable initiatives and target dates for enhancing staffing and addressing other challenges. You can learn more about IHS's agency response in the related video. Now, if you work in IHS, you may want to become familiar with the Office of Quality and the materials surrounding the strategic plan to understand the efforts underway, what they mean for you and your organization, and the resources available to support you. A second challenge we identified was to use the full complement of quality improvement methods. Over the last several years, IHS has taken important steps to improve both its approach to and accountability for quality of care. In 2016, IHS established an Office of Quality to centralize and strengthen efforts to ensure quality health care at all federally operated facilities serving American Indians and Alaska Natives. Among other efforts, this office promotes a culture of clinical and organizational learning, supporting all staff in developing skills and practices to provide the best possible care. We also recommended that IHS seek additional methods for monitoring hospital quality through new outcome or process measures, incorporating measures that are most suitable for rural hospitals. Further, within the IHS Office of Quality, standardization of data and reporting requirements is an essential function. As part of this, IHS uses the National Accountability Dashboard for Quality, a tool for displaying key performance indicators across the organization. IHS also developed and implemented a patient perception survey process to gather insights and inform efforts to improve the patient experience, and has a quality assurance and risk management committee in place to investigate safety and quality concerns. In addition, IHS has sought assistance from outside organizations, a common practice among hospital networks nationwide. And IHS participates in CMS's Quality Improvement Organization, or QIO, infrastructure. Among other functions, the QIO helps with root cause analysis of problems, development, and monitoring of improvement plans. Now, third, the small size of some IHS facilities can create a number of other quality-related challenges for many IHS hospitals. One of these is difficulty in maintaining the necessary skills to treat the most complex inpatient cases. Through our work, we learned that despite growing volumes of outpatients, such as emergency room visits, most IHS hospitals have very low numbers of patients admitted for overnight care. This translates to small numbers of high-risk or clinically complex patients and gives providers few opportunities to practice their skills. As a result, it is more difficult for providers in these settings to maintain clinical competence. For example, a provider that only does one intubation a year may have difficulty maintaining that skill. In addition, specialty providers may leave a hospital if they're unable to practice the kinds of medicine they trained for. And empirical evidence outside of IHS supports this concern, showing a correlation between lower patient volumes and poorer health outcomes. OIG recommended IHS include plans to maintain clinical competence in hospitals with low census in its strategic plan. This recommendation covers two key concepts: clinical competence and the unique needs of patients in small hospitals. One thing IHS might do towards maintaining clinical competence is to provide more guidance and technical information to hospitals about best practices in particular areas, including management of chronic diseases and maternal health. Now, on a related point, and as the fourth challenge, IHS has also historically had challenges related to a limited scope of services and access to community support. Most IHS and tribal hospitals are small. Less than half have operating rooms, and many lack important diagnostic equipment such as CT scanners. Where needed services are not available, hospitals must refer patients to non-IHS providers. However, the budgets to pay for referrals are limited, and IHS may be forced to limit referrals to patients with the most urgent needs. OIG recommended to IHS that its new strategic plan should address the need to expand referral networks and reduce denials of referrals for necessary services. Options include expanding programs to locations where American Indians and Alaska Natives do not have access to services, and leveraging technology such as telemedicine to allow for a broader range of clinical specialties. Modernizing healthcare facilities is another option that may facilitate a broader scope of services and access. IHS is also taking steps to improve access to prevention services, including collaborating with tribes in the development of community-based programs and incorporating traditional cultural practices in existing health and wellness programs. Part of the difficulty in providing services relates to limitations in resources and infrastructure and reliance on outdated equipment. Last we checked, the average age of IHS hospitals is nearly 40 years old, 4 times the national average for all U.S. hospitals. As you might imagine, these facilities were not designed with the current standard of care in mind, and many no longer are conducive to current medical practices and technological changes. In addition, many IHS hospitals have outgrown their facilities and do not have enough space for current and growing patient volumes. Aged, outdated facilities and infrastructure increase safety risk and make it more difficult to recruit and retain needed staff. Based on these findings, OIG recommended that IHS focus on necessary maintenance and repair of buildings and equipment. And the last key challenge, and perhaps the one of the greatest importance, relates to recruiting and retaining staff. At the time of our studies, staff vacancy rates for IHS hospitals were almost double those of other hospitals, with many underlying factors leading to those numbers, such as lack of housing, amenities, and job opportunities for family members, all of which are necessary to attract needed staff. Insufficient staffing can result in more difficulty meeting standards and maintaining sanitary conditions. Use of contracted staff in place of permanent staff can hamper continuity of care and lead to confusion about roles and responsibilities and organizational culture and practices. In several of our studies, OIG recommended IHS consider strategic initiatives to relieve staffing challenges, such as streamlining the hiring process to speed hiring staff, improving hiring incentives such as housing and better pay, and enhancing recruitment practices to gain from the largest possible pool of candidates. So what can you do to further efforts to address these challenges? As we have said, and you have seen in our visits to IHS offices and facilities, the agency has dedicated and skilled people who care deeply about their work. If everyone acts in unison to make these improvements, it will benefit both the organization and its American Indian and Alaska Native patients and their families and tribes. For those of you with facility leadership responsibility, supporting the big picture of IHS improvement helps the agency to focus together on needed areas. Leaders should also regularly review metrics to proactively identify and address quality and safety issues early. This includes monitoring of patient perception survey results. For all staff, you should be aware of these agency efforts, ask questions, and get as informed as possible about innovations, training, and new resources. And for everyone, be engaged in your care or your family members' care and raise concerns to your caregivers or leadership so that they can be addressed. As IHS continues these important improvement efforts to address these 5 challenges to providing consistently high-quality care, OIG appreciates being a part of identifying needs and generating recommendations for improvement. For more information on specific accomplishments and initiatives, please see our companion video on IHS's Office of Quality. We look forward to continuing to work with IHS in support of its mission of services to American Indian and Alaska Natives.